Today we'll be talking about basically we're gonna check on patient in the post-operative care unit. So immediately after surgery, the patient will be taken to the post-anesthetic care unit. And when he is in the unit, he is closely monitored by healthcare team to make sure he is recovering without any complication. In the post-operative care unit, the nurses will need to first of all to check his vitals to make sure they are not in abnormal readings. Vital signs are taken as order and recorded on the flow sheet. Operatively, routine vital signs measurements are usually taken every 15 minutes for the first hour, and then for the second hour, which is the next 1 to 2 hours, is every 30 minutes, and after that, every hour for the next 4 hours, and then every 4 hours as ordered, and finally can be put back to the normal ward where all the patients are in. For body temperature, basically the patient is measured using an electronic temperature, and most accurate would be the pulse rate. And pulse rate is basically the number of pulsation felt in 1 minute. So this is where the nurse would usually check for the pulse. This is what we call as radial pause, and basically you place 2 fingers on the wrist here and you press it hard to feel the pulse, and then you count the number of pulse under 30 seconds or either 1 minute. Respiration rate, and for this you need to count the number of times the person breathes in 1 minute. So a normal patient or a patient who has no complication or symptoms has 12 to 20 times per minute. And now we will be measuring the respiration rate, and basically you count the number of times the person breathes in 1 minute, and basically one breathing is the rise of the chest and the fall of the chest rate is counted as one breathing. Basically one breath is an inhalation and an exhalation, and you watch the rise and fall of a person's chest. Basically they will measure you by manometer, which is placed on your brachial artery, or they will have an electronic blood pressure measurer, which is much easier and can be seen on the monitor. So yeah. To check on the surgical incision area or the wound dressing area, and basically see if the dress is overflow with blood or anything, or to check for any infection, and to change if needed or inform the nurse. The thing that you should check and record is basically the urinary output from the catheter. And measure the volume of urine that is produced. So yeah.